Welcome everybody to Optometric Education Consultants National Webinar Series, Sunday night edition. Tonight's topic is Integrative and Functional Medicine, new optometries for new opportunities for optometry. And we have two speakers tonight. Our speakers include Dr. Greg Caldwell, a graduate of the Pennsylvania College of Optometry, where he also finished a one-year residency in primary care and ocular disease at the Eye Institute in Philadelphia. He's a fellow of the American Academy of Optometry, a diplomat of the American Board of Optometry, and a fellow of the Optometric Glaucoma Society. He currently works in Duncansville and Johnstown, Pennsylvania, as an ocular disease consultant. He is well versed in managing anterior and posterior segment ocular disease, and has been a participant in multiple FDA investigations. He has served as the president of the Pennsylvania Optometric Association and served for 3 years on the AOA Board of Trustees. He's president of the Blair Clearfield Association for the Blind. We also have Dr. Tracy who attended Temple University School of Pharmacy in Philadelphia, both for undergraduate and graduate degrees. Upon getting her Doctor of Pharmacy degree, she completed a residency at Temple University Hospital, where most of her time was spent in internal medicine and infectious disease. She's on faculty at Salus University in the Department of Optometry, where she's a course director and instructor for all systemic pharmacology courses for the students in optometry, audiology, and physician assistant program. She's also a practicing clinical pharmacist with a pharmacy and patient care practice in Rosemont, PA. She also is unique in that she is a fellow of the American Academy of Optometry. So with that, I'm going to turn over to our speakers, Dr. Greg Caldwell and Dr. Tracy Offenall. Guys, take it away and take it home.
Thanks, Joe and Tracy. We're sitting about 7:09 right now, so let's make sure we go to like 7 or 8, actually 8:50, so somewhere around that range. All right. With that being said, Joe, thanks for the introduction, and here are my disclosures. Basically, what I want to hit on this is that this lecture presentation was independently prepared by Tracy and myself. It has really no influence from anyone that's been listed here. And the content and the format of this course will be presented if I'm talking about any product or any instrument or along the way without commercial bias. It does not claim superiority of any other product or service that's out there. I will disclose I'll be showing some OptiView images and the scanner, and I have both of those in my office. Tracy.
Ditto, Greg, in terms of no financial or proprietary interest in this and no commercial bias, and I have nothing else to disclose.
So, Joe mentioned this a little bit earlier. I believe Tracy is the only pharmacist. There are some pharmacists and ODs out there, but Tracy is a pharmacist, teaches at the school, and is a fellow. And we just came back from Boston, and we shared the stage together. And Tracy, I know you did this a year or two ago, but congratulations again for supporting optometry. What do you call yourself?
Optometrocentric pharmacist.
There you go. Understanding the optometry side now pretty well. The course description's in the handout. I'm not going to really read that to you. We want to just really jump into the course here. And with that being said, Joe, I'll take care of this first polling question. Okay. And we're going to launch it. And then just real quick out there to the audience, the optometrist taking this course. Do you consider yourself an integrative optometrist that's out there? Yes, no. Getting a nice response here. Do you consider yourself an integrative optometrist? All right, let's see. Looks like we're getting up there pretty nicely. Thanks, everyone. Again, by replying, it helps us keep this live and interactive. All right, we're going to end the poll. And Tracy, we got majority feeling that they're integrative, and about 60% and about 40% saying no.
That's pretty impressive.
All right, it is. So we're just going to launch the next polling question here, in a sense. have you ever recommended or prescribed, if you want to say, EPA, DHA, omega-3s, not all of these, but just have you ever prescribed lutein, zeaxanthin, AREDs when it was back in cool, and or AREDs to a patient? And good, thanks everyone. That was a quick reply. So and we have 99%. We have 2 people that have not. So the reason why I bring that up is that with this is that the numbers don't really match up, right? We have about 60% that consider themselves integrative, and we have 99% that have prescribed some type of supplement out there. So if you prescribe some type of supplement, you've kind of done some type of integrative medicine or complementary. Did I say it right, Tracy? Did I get it? Complementary medicine. So we have allopathic medicine out there, which is Western medicine. And then you have the homeopathic or maybe alternative and functional, which kind of reaches into the cause and the why. Tracy's going to go through some definitions here, but I just pulled this right out of Dr. Google here. Is what is integrative medicine? And the practice of integrative medicine refers to blending conventional and evidence-based natural or complementary medicine or therapies with holistic or patient-centered in a sense. So, one of the best ways that I can think about it is, you have someone that it's getting, VEGF injections and you recommend AREDs too. You're kind of using something that's allopathic and anti-VEGF and using something that's out there in nature, right? Different types of minerals and vitamins to try and complement and help out this macular degeneration problem. You have someone that's you have some type of dry eye, meibomian gland dysfunction, and you're trying to use omega-3s and omega-6s and GLA and EPA and DHA. In a sense, you're trying to use something that is maybe lacking in someone's diet due to what we're going to talk about, some food sources that are out here, or the SAD diet, the standard American diet, which is great that I'm in the Altoona area. So I can say the standard Altoona diet, which, we're trying to help supplement. So it's been really cool. My whole life, I've really, since my ocular disease residency, focused on spectral domain and macular degeneration, glaucoma, focusing on structure and function, using allopathic medicine. You saw my disclosures there. All those companies that are there, glaucoma companies or steroids and so on and so forth. So I truly believe in the Western and allopathic side. But patients a few years ago asked me about supplements, and I started looking, and 90% of my patients were coming in and they needed some help and needed some guidance. So in a sense, I consider myself a transitioned from ocular disease optometrist to an integrative optometrist. So the ones that were at 60% there, you are doing some sort, if you were replying to this, to this polling question here of saying, 99% of you prescribed one of those, you're doing some type of complementary medicine that's out there. And that was the thing that I learned quickly with Tracy way back. I don't know how long is it now, Tracy? 5 years, 6 years we've been lecturing together. How long has that been?
Yeah, probably 6 or 7.
Yeah. And, one of the first things that I found out with Tracy, right? I'm thinking pharmacist, prescribe drugs. And one of the first things I found out from her is, she tries to treat things in a natural way that's out there before, maybe putting the patient on medication, or the doctor prescribed it, but maybe we'll have some natural way of discussing with the patient that's out there. And here's some thoughts. I need to get a better picture of this. This is basically taken off of my phone because I was so excited to send this to a few people. And you're going to hear me talk about, lutein and zeaxanthin treating the inner retina. And then we have this whole outer retina that kind of gets ignored. And that's where the disease process is in macular degeneration. And you can see right here on September 29th, 2020, that I have this patient that came in with drusen that had progressed. I should put the third one in there, that had progressed from about 9 months ago. And there's really nothing tricky here. I tried and I spent, a lot of time making sure I got the same exact cut. You could see a blood vessel to a blood vessel and the RPE coming into the optic nerve here. You could see this little RPE, a little extension right here. So I got the same cut, and you come down here to June and you can see the drusen have definitely gotten smaller and decreased in size. Nothing tricky with the magnification. And it just kind of more or less focused on the patient's diet, and kind of what I'll say tonight is a full retina supplementation as we get into it. Within the United States, the US healthcare, our system is set up for sick care. We have, great sick care system, as you'll hear out there, people reference. But I'm not going to throw our healthcare system too much under the bus, because the whole world comes us for crisis training. I was just with a doctor who was a integrative primary care doctor from Costa Rica, and we were talking. And and I've been outside the United States quite a few times. They look up to us for crisis care. Their vascular surgeons and their cardiac bypass team have all come or trained within the United States. But where the rest of the world says is like, we don't really do much with, trying to do for preventive. But that's shifting. I can tell you right now, I've been watching this shift. I'm third-party chair for the POA. I'm working with UPMC and Geisinger, and they're talking about paying for wellness. And you kind of see them kind of doing that by go get your blood pressures checked and do this, and diabetic patients do this, and maybe they get gift cards and so on and so forth. Just the movement is into prevention. And it is the second most topic on the internet that's out there. When you boil it all down, nutrition, people are looking for nutrition, lifestyle, and being healthy. So, adding life to years and adding life to years and adding years to life is kind of, where we're moving here. So what's trending is, you'll see, and I was just, talking to someone out at the academy, and they said, oh, what'd you and Tracy and I just did this lecture about 5 days ago now, it was Wednesday at the academy. And I said, oh yeah, we did it on functional medicine and integrative. And right then and there, she goes, oh my gosh, I'm seeing a functional doctor next week. So, more and more people are moving into seeing functional docs and integrative docs that's out there. So with that being said, Tracy, you have a few definitions here. Let's see if the remote has transferred over. I won't touch it, and I'll let you go through some of these definitions out there.
All right, thanks. So we just wanted to make sure that, we differentiated between the traditional Western medicine, or what we call conventional medicine, that most of us, all of us really, were trained in our allopathic universities and med schools and OD schools, pharmacy schools, et cetera. And like Greg mentioned, that's one of the wonderful things about who we are. People come from all over the world for crazy surgical interventions or really serious diseases that need to be treated and fixed, et cetera. But on the flip side, we look to other countries that are much more advanced from an integrative and functional perspective. And we'll go through a little bit of how this has changed even since COVID in just a little bit. But I just wanted to run through and show you, we've got our traditional or our Western medicine. It is based on theories, beliefs, and experiences. So our idea of conventional medicine or traditional medicine is different than somebody who lives in Europe or Asia, et cetera. Everybody's got their conventional medicine, but it's a little bit different where you go from place to place. The big thing to point out is with conventional traditional medicine, it's used to prevent, diagnose, improve, or treat physical and mental illness. And we're really good at treating most things. It's in the preventive arena that we're really in still kind of the infancy stage for a lot of this. Since it is endogenous to a culture, like I said, it's going to change as you go from place to place. And this is the way we typically utilize our skills and meds to treat our patients. And it's a wonderful thing, but we can do more. So on the next slide, you see here, I just wanted to show you, it's a definition that comes from the National Center for Complementary and Integrative Health, as well as the WHO, and they define complementary and alternative medicine as a fairly diverse definition that includes healthcare systems, practices, and products that are not part of conventional, traditional, or what we would call Western medicine. So complementary, which is my favorite, because complementary is literally taking the non-mainstream tenets of integrative and functional medicine and combining them with our traditional, our conventional, our Western medicine. It's the best of both worlds, truly. And then we can take it a step further and truly make it an integrative and functional piece of patient care. And we'll look at that more in a moment. Alternative or non-mainstream, again, medicine practice is without conventional or Western or traditional medicine. So I've been to practitioners where they say, we're going to do nothing with medication. I don't want you on any medication. I don't want to do anything that's, the traditional. We're going to do everything as an alternative form of care. And certainly in some scenarios, that's probably reasonable, but in most of our patients, it isn't. So then we go to the next step with integrative and functional. We'll look at integrative definition real quick. They are very similar. It's just kind of approaching the patient from a complementary perspective in just a slightly different angle between the two definitions, integrative versus functional. So integrative, as I mentioned before, is the complementary medicine plus conventional medicine practice in a coordinated manner. So it's not necessarily just throwing a single supplement at a patient and that's going to be, the complete definition of their integrative practice, or multivitamins and now you're an integrative practitioner. That's part of it, but that's not what makes you, a true integrative practitioner through and through. Now, with that being said, it doesn't mean that every time you're going to look at a patient or choose something, you're always going to choose the complementary side of things. It's you're going to choose it where you can, where it can benefit a patient, where it can prevent something from occurring at all or getting worse. And that's the beauty of it. We use it to regain health and maintain health. Similar definition to complementary, but it's a coordinated manner that really, defines this part of medicine. Focuses on health and well-being, eating, exercise, drugs, chemicals, fluid intake. So I've listed a few things there. It's the mind-body connection, which is so important. Some people do yoga. I do Pilates. I love that. Massage therapy, acupuncture, mindful meditation. Mindful meditation can be prayer. It can be biofeedback. It can be heart math. It can be lots of different things. But there is an absolute connection between how we sort of treat our minds and try to maintain our mental health along with kind of whole body well-being. And it's such an important piece of the puzzle.
And Trace, I don't have it in the in this part of the slide deck, but you and I were chatting about this while we were out at the academy about, glaucoma. We're all going with, lowering the IOP, absolutely. But there's, repeated studies and repeated trials out there where mindful meditation has helped lower the IOP than, like, say, the non-study group that's out there.
Yeah, we've seen that in blood pressure as well. So what we're looking at here then, I've mentioned integrative is the best of both worlds. Practitioners are utilizing our traditional, our Western medical practices rather. It's been largely considered to be alternative or non-traditional in the past. And that's what, in the past few years, we're sort of seeing a shift in lots of different communities. Integrative health choices in optometric care, and it can go far beyond this. Vitamin supplementation, specific vitamins that you can use individually or together, fish oil, anti-allergy supplements like quercetin. We're going to dive into some of those as we move along here. And lastly, just our functional medicine, very similar to integrative. The only difference is functional medicine kind of approaches it from a full systems medical approach, and it helps to identify underlying root causes of each individual illness or disease. Integrative medicine does that as well. It's just kind of approaching it from a slightly different angle. It's looking at the patient and their lifestyle choices, their genetics. Functional medicine does that too, but functional medicine takes just a slightly different approach in terms of the diet and exercise, just how they approach it with the patient. Functional medicine focuses on creating individualized therapies to treat the cause of illness. Integrative looks at a patient as a whole and applies therapy to improve wellness. They're very, very similar. Some definitions that you see in functional medicine and really integrative as well. It's the biochemical individuality of each patient. Greg's going to go into a little bit more of this, but the genetic factors, for example, we know that there is some genetic factors that play into cancer, heart disease, diabetes, and really lots of different inflammatory diseases and conditions. There's something called pharmacogenetics or pharmacogenomics, which looks at how genetic variations can contribute to differences in patients regarding kinetics, how drugs move through the body, what the body does to a drug, adverse effects, drug interactions. And I've done this. I've done my pharmacogenetics or genomics, same thing. I've done my daughters, I've done my husband, just from an academic perspective, really, but just to kind of see, well, how are we different from one another? And, what are some of the ways that our bodies might be unique in terms of if we ever had to use an opioid or an antidepressant or lots of different things. It's really an interesting 25-page document you get when you complete it. Like integrative medicine, functional medicine looks for what it has been contributing to or causing a disease or an illness, rather than just treating the underlying or end symptoms. So in other words, we just don't want to get into the habit always, which we do, of saying, oh, you've got reflux. Well, let me give you a Prilosec or an Nexium, or hey, maybe we'll do both, and never looking at, well, what's contributing to that particular issue? Even dry eye is a perfect example of that. All right, poll question number 3.
So
You've
poll
heard
question number 3. Have
go
you
ahead.
heard choose your parents wisely? What percentage of your outcomes in life are based upon the DNA of your parents? Is it 8, 28, 68, 98? Choose your parents wisely. We hear that a lot. And Joe, thanks for launching the handouts. 722, you sent the handouts out. I don't see any questions rolling in yet. And I will echo the apologies for some of the glitches tonight that Joe put in the chat. All right, we got a pretty good response here. I'm just going to end the poll, share the results, and you'll see here that 14%, 18 people believe that 8%, and then ramping up to 68%, and then dropping back down. A few people thinking 98%. So I'm going to stop that sharing and move on to the next slide. So choose your parents wisely. It just isn't as true as it used to be. Some of the genetic factors out there and research in this is that your lifetime health is basically 8% of your parents' DNA, your nucleus that can't be influenced. 92%. That's why you're hearing a lot of, diet, lifestyle, exercise, meditation, and taking care of yourself, because this is that epigenetic part. Those are the things that are out there. We could do a DNA test for someone, and I'm getting into that now using a company called Visible Genomics, but there's other companies out there, and testing to see if the patient has the risk alleles. If the patient has the risk alleles, that just means the gun is loaded. That doesn't mean that it's going to be triggered. That's all I can really speak about that, because I'm going to start now testing for those and seeing how my kind of integrative approach will change over time. I have an integrative approach that's for the patient that comes in. I think we all do to some extent. And we're just always trying to maybe help out maybe better as time goes on, and you'll see in CEs like this. So, that's why you see a lot out there. And that was kind of funny. I was walking through a hotel on this was at the Academy, November 2nd, walking down the hallway. And you could see here that this person outside the room here, left their plate. They had some breakfast, and it looks like they ate the eggs and the potatoes here. And maybe some bacon was on here. And they used the high fructose corn syrup, right? We all hear that, ketchup is so good because it has lycopene in it, but then they, squash it with the high fructose corn syrup. But then you'll see as we go through here, I kind of laughed, and, they left all kind of the good stuff that we're going to be talking about tonight, right? They left the carotenoids here, or the antioxidants sitting here. So I just so much wanted to knock on that room and say, hey, can you like finish this for me? Because I'm almost on my way to a lecture to talk about this. But you know what? I took it as an opportunity, and I said, why would I help them out? So I just ate the cantaloupe and the pineapples. No, I'm just kidding, guys. I did not. I left it sit there. But those are the things that now, as I'm walking down the hallway and doing this and starting this research about maybe 3 or 4 years ago for my patients. And what I found out was like unearthing a tree. Every time I thought I had something, it led to something else. So Tracy, you want to talk about functional and diagnostic nutrition?
Yeah, so this was something, that Greg and I included in the lecture, and it was something that I've looked at for quite a long time. And it was interesting because right after we gave the lecture, we were speaking to a couple of optometrists, one of which said that up until recently, you were not able to become a functional diagnostic nutrition certified optometrist. In other words, as an optometrist, you could not become a functional diagnostic nutrition specialist, which is crazy because a nutritionist can do that. A certified strength and conditioning specialist can do it. But the beauty of functional diagnostic nutrition, and you're going to see this kind of interlaced throughout the rest of the lecture here and there, takes consideration the entire body that is something out of balance. So that's kind of the whole process behind inflammation, oxidative stress, cytokine increase, and inflammation that we see in patients. So this lack of homeostasis, because we're completely out of balance, leads to symptoms or disease. So I want to show you on the next slide. It's kind of an interesting way to approach patients, but I love this. So usually I do it with about 16 different animations. Greg can tell you, we took them out just for time purposes, but there are a lot of hidden stressors that are going to contribute to our oxidative stress, which ultimately, after multiple steps, leads to inflammation. That inflammation can be acute or it can be chronic, but these hidden stressors include hormones, immunity, digestion, detoxification, environmental, and neurotransmitters. So this looks at everything from what you're involved in at work, at home, where you grew up, to things like how is your gut? We're going to talk about the gut microbiome, as well as neurotransmitters. You may have neurotransmitters that are out of balance. So essentially up here on the top right, we're looking at the brain and how the brain and whether or not it's in balance contributes to the body, which then you look at whether or not between the brain and the body, we have normal function. And typically we do not by the time we see a patient in traditional Western medicine, because once a patient has abnormal function and that's contributing to either, yes, I'm good, I'm in homeostasis, or ease, but most of the time we see them when they're in lack of homeostasis or they have disease and then they have symptoms. And then in my world particularly, that's where they're like, hey, do you have anything to treat chronic diarrhea? And I'm like, well, why do you think you have chronic diarrhea? They literally just want the Imodium to stop it, which isn't going to help the situation. You have to figure out what's causing it. And this is the model by which we live, particularly, you see it as well, but particularly in my world where there's always just a drug to fix it. And I've had many, many patients say over the years, no, thank you, I'll just take the drug. You can think of 15 different ways to fix the problem. They're like, no, I'll just take the drug. After all, that's what drugs are for. And it's a tough way to live, but that's how some patients and practitioners kind of think of things.
Is that me now?
That's you, boss.
Okay, there you are. I just want to make sure I saw some clicking going on there. So I just like to just chat here and just say there's clinical labs out there in the United States. There are approximately 15 billion laboratory tests that are performed annually, over 200 CLIA certified laboratories. Remember CLIA, that we get the CLIA waiver when we want to test for the, the tear osmolarity, and over 100,000 clinical lab tests that are out there. And there's 50 to 100,000 more that are in development. Now you'll hear the word biomarker, and biomarker is a test that has meaning. And probably one of the best way to think of a biomarker that we do within our practice is IOP measurement. Goldman is a test because it has meaning to us. We measure intraocular pressure, and we know that if the higher the pressure, there's a chance or risk factor of glaucoma that's out there. And cornea hysteresis is now becoming another biomarker for a glaucoma that's out there. Now, when you talk to the integrative and functional docs that are out there, the ones that are kind of devoting their life, they kind of look at, some predictive biomarkers. They're biomarkers that are, that you need to kind of keep in that kind of Goldilocks type, not too much, not too little, just kind of in the sweet spot. And I listen to some YouTube and listen to some docs that are out there that prepare for meetings and lectures and so on and so forth. And, there are some that believe that there are just 8 predictive biomarkers that when studying the centurion person, the person that lives to be 100, and they look at them, they see that like their hemoglobin A1C and their C-reactive protein and plasma homocysteine. And that's why vitamin D has become very, very big over these last few years, because primary care doc can actually measure it and then, give people, like 5,000 units worth of vitamin D, and there's some out there that feels that, if we would just give vitamin D, out there, airports, grocery stores, just give everyone 5,000, we'd see a lot of diseases go away, because we just lack a lot of vitamin D, especially that 37 parallel and above. And, another one is the omega-3 index. And this is just one example of a predictive biomarker, but I picked this one because it fits in with within optometry. And, hyperhomocystinemia is a blood test, and approximately 5% of our population has hyperhomocystinemia. And when these levels go too high, it's been shown that the methylation is not working properly. And now blood vessels won't repair a certain way. And now this puts us in for increased risk of stroke, atherosclerosis, and suffering from chronic disease. Dr. Salka's on here, but if I would ask him, Joe, I had someone come in that's, 42 years old, 38 years old, had a venous occlusive disease, he would probably say, Greg, don't work them up for high blood pressure, diabetes, maybe get some blood work, get some coagulability tests, but also get the homocysteine checked. They might have hyperhomocystinemia, because in someone young, we see that type of vascular occlusive disease. We just had someone speaking a few weeks back or a few days back, Dr. Julie Rodman, she was referring to this, and when she was talking about her occlusive disease, and one of the ways to treat it is to check this out. Using vitamin and antioxidants deficiencies have been identified as a common risk factor for forming this, so resulting in impaired folate methylation. And I thought that was a pretty unique acronym there. Going back again to pick your parents wisely, maybe something that we're eating and we're not getting enough vitamins and antioxidants in our diet has now resulted in this hyperhomocystinemia, and that's how you can treat it. And there's a dietary food that Tracy was telling me about. Tracy, do you want to tell me about this dietary food that's out there that can help treat this condition?
Yeah, it's an interesting dynamic because several years ago, maybe 5-6 years ago, cardiologists and hematologists started treating people for hyperhomocystinemia with this methylated folate. And so there's this dietary food now, which is available. It's one of many, but a dietary food is unique. Just to give you a real quick synopsis of what this means, a dietary food is a nutritional supplement. It is prescription. It does not go through clinical trials. It's prescription because the FDA wants to oversee it. So in order for something to become a dietary food, somebody just says, I think that for hyperhomocystinemia, I'm going to create a food-based product. It's usually something, it's essentially somebody saying like, you'd have to eat 15 pounds of carrot, 43 things of kale, and 14 pounds of beets in one day in order to get that amount of nutrition to fix whatever problem. It can only be for one disease or problem. So this L-methylfolate cannot be for all potential inflammatory conditions. They have to say it's for hyperhomocystinemia. And then the FDA will say, okay, great. Now you're a dietary food for hyperhomocystinemia. And the cardiologists and hematologists that were using it were basically like, it's not integrative. It's just, fixing the problem that's there. And at first I kind of thought, no, you're wrong. It is pretty integrative. But the more I thought about it, I thought, you know what, you're right. Because from a true integrative perspective, what we would do is replace the patients or go in and rework their diet and try to fix the things that contribute to hyperhomocystinemia, which is typically not enough of the rainbow foods in your diet. It's not the only thing that helps sometimes, but it's a good way to start.
So here is just, an example. I just kind of screenshot this, is that ocular.
I'll find it.
This here. I got that one, Joe. All right. Someone came off of mute. So hyperhomocystinemia, here's one that says ocular manifestations and their response to therapeutic modalities. And if you just kind of go down here in the abstract, it says approximately 5% of the general population has it. And then, they did a study out of 59 cases. 25 patients showed ocular findings such as branch retinal vein occlusion, papilledema, visual field defects, ocular ischemic, this kind of vascular that's out there. And then in the conclusion, they were saying about using vitamin B12 and folic acid shows to decrease the risk of these complications caused from these elevated levels. Just continuing the search, just going out. Here is serum homocysteine, vitamin B12, folate, and the prevalence of a posterior subcapsular cataract. So I did have a patient the other day come in prior to going to the academy, early PSCs, no steroid use. So we would link that to steroid use, and patient, no steroid use, kind of dug all over the place. So we're ordering the homocysteine levels on this patient. And I thought this was kind of interesting. Alan Glazer, he has ODs on Facebook and all these different social media routes. And I think this was on his LinkedIn, and he's talking about his Retina Rocks thing that he does. But he's posting this 61-year-old male who had this CRVO and then touting Ozurdex and how well it worked. And you can see here in the middle picture the CRVO, and then use the Ozurdex, and you can see the response to the OCT. But then Glenn reaches out and says, very nice outcome for oral administration, but using Lumbrokines. Did I get it, Trace? Lumbrokines?
Yes, Lumbrokines.
Lumbrokines. So, and, using traditional Chinese medicine here. Dorothy, who I just saw at the academy, puts in this nice little link, and then Glenn thanks her for putting in this nice reference. But what I wanted to point out is when I clicked on the link, she puts the link to evidence-based complementary medicine and alternative medicine, where they're using this lumbrokinase. And then they go through the article, they say it comes from an earthworm, and they were talking about how they can get that transgenic into the plant to maybe then be produced and then to be able to be injected or be taken in foods that's out there. But I just thought it was kind of neat. I'm clicking through and just watching this kind of allopathic way and someone's dropping in there about Lumbrokines and how they use it to help break up those clots. So, maybe someone would say, like in a macular degeneration patient, don't worry about the VEGF. This takes some, resveratrol, as you'll see here, has a natural anti-VEGF, or in your vein occlusions, don't worry about getting those injections. That would maybe be truly functional or maybe truly alternative, but that's not what, I'm sitting here advocating for. I'm advocating that, saying, hey, look, there are, and we do it all the time, we just didn't really realize it, that we're using different types of, nutraceuticals, whether it's omega-3s or vitamins, to help these. So that's why I have new opportunities in optometry, is that we've kind of been doing it all along, but now it's becoming a little bit more evidence-based or outcome-based medicine for diabetic retinopathy, within glaucoma, macular degeneration, dry eye, and many, many more, with all the rheumatological conditions and basically all the 300 conditions that are connected to the eye, or we can diagnose within the eye conditions, along with, Alzheimer's and dementia issues that we're able to pick up, and the correlation, maybe early intervening with nutraceuticals in some way. So, there are, new opportunities in a sense. I think we all, as optometrists, 99% of us said that we've used some type of supplement. So I think there's different levels, right? So I think we're all, in a sense, a novice. Maybe there's someone out there saying, hey, I do more. I'm not a novice. I'm an expert in integrative optometry. That's great. I've bumped into those patients, and Stuart Richer and the Owens with the Optometric Wellness Nutritional Society. They've been around for 20 years. Bumped into Julie Poteet over at the Academy. She sat in the lecture. She was really excited to hear that we're kind of bringing more exposure to this. So with that being said, Tracy, why don't you take this slide? This seems to be your slide.
So just now setting up kind of the rest of the lecture or discussion that is going to look at oxidative stress, and how oxidative stress, which leads to inflammatory cascade and full-blown inflammation, is really the root of all evil in our bodies. And it can be acute, or it can be something that smolders. So lots of times, in a patient who has a disease like my father, who's got giant cell arteritis as well as polymyalgia rheumatica, he said, oh, my erythrocyte sedimentation rate was great, but I'm still having problems, and I'm still having acute flares. And I said, well, sometimes that happens. I mean, if we look at some of your other lab markers, like the C-reactive protein, et cetera, we would see that was higher than it should be. So this inflammation leads to heart disease. We have information that proves it leads to cancer, or part of the puzzle for cancer. It's linked to cognitive decline and Alzheimer's disease. As a matter of fact, some people consider Alzheimer's disease to be sort of diabetes type 3, just from an inflammatory perspective, some mental health diseases, and autoimmune diseases. And there's overlap between most of these things. As a matter of fact, if you look at the autoimmune disease that we have listed here, we've got thyroid eye disease, we have rheumatoid arthritis, lupus, psoriasis, Crohn's disease, et cetera. And the list is much longer than what I have listed there. But an interesting statistic, just to show you the crossover, if you've heard me speak, I have rheumatoid arthritis and lupus. The level of cardiac risk in somebody who has rheumatoid arthritis with no risk factors for cardiac. So let me say that again. So because I have rheumatoid arthritis and chronic inflammation, despite the fact that I have a completely healthy heart, no high blood pressure, no cholesterol issues, no diabetes, et cetera, my chances of heart disease or having major heart problem, heart attack, or ischemic stroke is almost 3 times that of the general population, because I have inflammatory disease. So there's crossover between all of this. Your body interprets inflammation as just that, inflammation, and it's just going to kind of hit some body parts or manifest itself in a different way in some patients. But from a cardiac perspective, it interprets it the same way. Inflammation is bad. So what can we do about it? Well, we have quite a few things that we're going to run through here quickly, but the last definition I'm going to give you is just a setup for our dietary supplements or nutrition supplements. The FDA does have sort of jurisdiction over these, but only to a certain extent. The main thing to remember is that it is not legal in the United States to say that a nutritional supplement, a dietary supplement, a protein supplement, a pre-workout powder, mineral, an herb, a homeopathic, whatever, they're not allowed to say that they diagnose, treat, prevent, or cure a disease or a condition. So you can talk about them. You know, you can say, oh, here's my resveratrol. It's a great drug for oxidative stress and inflammation, and it can be used here, here, and here, but they can't put it on the labeling. As a matter of fact, if it's on any of the labeling or advertising, the FDA is going to come after that individual or that company that is marketing it. They can have unwanted effects, but they can have good effects too that might surprise you. You just have to kind of know what you're dealing with, and people can get into trouble if they're taking, dozens and dozens of supplements. So you just have to know what you're talking about, where to get the information, and how to counsel your patients. So I'm going right to the false disease claims with Greg, but the slide previous to this was just showing that the FDA does have some jurisdiction, and essentially, if a problem occurs, patients start to get hurt, somebody dies, etc., then they'll come after the company or the person who has made that product, make them pull it off the market. And that's about how it goes. There's just not enough manpower in the FDA to police the dietary supplements like regular prescription drugs or non-prescription drugs like over-the-counter meds. So that's why it's so important to work with a company. And there are several out there that are great. A company that is an authentic company that has outside lab testing, just great oversight. That's one of the most important things that we can talk about with our nutritional supplements. Greg, this is your slide.
Yeah. So, just kind of echoing what you're saying about the disease claims that's out there, which gets confusing from time, is that, red yeast rice is what was actually the molecule that I actually got to meet Dr. Chang, who then for Merck changed it to a different structure. They were able to then, because you can't patent a natural substance, right? So, like hypochlorous acid for that we use to treat blepharitis and to kill some of those. It's naturally occurring in a white blood cell. Can't really patent that. That's why you see a whole bunch of products that are out there. But if you can change it a little bit and so on and so forth, now you can patent that structure, and then you can turn it into something like Lipitor. Then you can start making disease claims. So that's why you'll see a lot of it out there. I was actually, as I was getting ready to fly home today, the Super Beats commercial came on, and they were talking about, how great they were, so on and so forth. But they didn't say anything about, yes, we're going to lower blood pressure, but it said that, I think the word they used, and I forget how they said it, but it promoted the assist, or the word was promote that they used, promoted blood pressure control. That was out there. Didn't really say that they would lower it, but it would help promote it. So that's why that's out there. But this is why sometimes they get a bad rap. All I did is I went to the U.S. Food and Drug, clicked on, dietary supplements here, and then what were the recalls? And you can see the list goes on here. And I kind of went to the very end, and you can see that there's 1 of 10 pages, 52 entries. But you can see here, this one was recalled for salmonella. And then, I don't know, Tracy, go up to August, or April 1st there, undeclared. What are those molecules and products that are out there?
Well, if you look next to the dates in the blue underline, those are some of the brand names of the dietary supplements: Premier Zen, Platinum 5000, Triple, Supreme Zen, et cetera. And that would go on and on and on. But essentially, those were dietary supplements for erectile dysfunction. And what they found in the nutritional supplement was that they actually had sildenafil, which is Viagra, and tadalafil, which is Cialis. they had those two substances in the over-the-counter nutritional supplement. So it's an undeclared, essentially they're saying it's a drug and you didn't tell us it's a drug. And that can be incredibly dangerous, particularly in people with cardiac issues. So that's why you need to have a good company that you purchase from or work for.
And Tracy and I have identified those, and we're really not going to really highlight those tonight, because in the spirit of COPE and ARBO, if you start bringing up companies, you kind of have to be fair and balanced. And there's so many companies out there that, if you guys ever want to, you'll see some of the products here tonight. I'm going to hide the names, but if you guys want to reach out at some point to Tracy and I, we'll be able to help you out. But I agree with that. You have to, there are some nutraceutical companies out there, they have no scientists on board. It's just Joe and I decided, hey, this is good for glaucoma. Let's call it the Greg and Joe vitamin. And, we get our sourcing by just saying, hey, we believe that's blueberry extract and that's resveratrol, but we never really test the source. We just agree and don't check the quality, so on and so forth. But there are other companies out there, as Tracy and I know, that in a sense treat these as pharmaceutical grade nutraceuticals. And I guess that's the key that we're trying to point out. Now, I did get a question here to the private that came from one of the docs attending. It says, do you recommend turmeric for its anti-inflammatory properties? And I'm going to say yes and no at the same time. I used to that's why I have the slide up here, and that was a good lead into that question is, I don't usually, what I've learned in my last few years is, we're going to learn about resveratrol tonight and how great it is for anti-VEGF, but I usually just don't use resveratrol, or we have the most amount of resveratrol or turmeric. Turmeric is a great anti-inflammatory, but what I've learned is, we need to kind of have everything out there. A relies on C and C relies on E and magnesium and all these different minerals and vitamins and flavonoids and polyphenols and carotenoids. They all kind of need each other. So when you start hearing and I start seeing we have the most amount of this or the most amount of that, I think that can start throwing off some of these supplements that are out there. So, consider lifestyle and full supplementation changes, food changing, getting away from maybe a bad diet. Tracy always says, and I quote this, and I'll just say it for her. She always says, look, it's always great to get it from the natural source. But, sometimes, the natural sources aren't the great, and we got a supplement that's out there. So, Tracy, what did we learn from COVID? What did COVID teach us?
Well, it was a hell of an interesting time for all of us, the past couple of years, and we seem to be stuck in this COVID rut that we, we're slowly getting out of. But one of the things that was really so interesting, Greg and I were at SECO the first week in March of 2020, and that was really when, the so-called what was hitting the fan all over the world, and particularly in the United States. And by the time we got home from SECO, the 9th of March, that week, then things really took a turn for the worse. And the entire week that we were there, I have sort of this flu protocol that I use that's got, high dose vitamin A, high dose D3, it's got melatonin in it. It's just got a whole list of things that are antiviral, et cetera. And we weren't the only ones talking about it, because by the time I got home, and I was recommending this and giving this to so many people, by the time I got home, you couldn't get most of these supplements anywhere, because people all over the world were doing the exact same thing that we were talking about in Atlanta, March, 2020. So COVID caused the world to have to look at their epigenetics, what they're doing that may contribute to getting COVID-19 and potentially a very terrible case of SARS-CoV-2. We don't have all the answers, but we basically were faced with a situation where we didn't have anything that we could take. We couldn't do anything about COVID. And so everybody was looking to the naturopathic and holistic way to approach it. And that really has changed people's minds in a lot of ways. Like, wow, I actually have some control control over this. So with all that, we know that age, comorbidities, multimorbidities, hydration status, stress, etc., that all contributes to potentially, if we get COVID, and if we get COVID, how bad it might be. And there's data to support that. So it's kind of just organically unfolded in such a way that most of us now are kind of looking at this as something positive.
Yeah, and to kind of feed off of what you're saying there, Tracy, is the COVID virus, that cytokine storm needs that oxidative stress to cause the infection that's out there. So, and then there are lots of evidence and outcome-based evidence coming out now. Here's one. It says the inflammation linked to the role of nutrition for the potential mitigation, nutrients such as C, D, zinc, but then nutrients with anti-inflammatory, anti-thrombotic, and antioxidant properties may play a preventative role here. And this is not, these are magazines that I've been learned to look at and read by, functional docs, integrative docs. Where do I go and read about this? Where's some good sources? I write for Review of Optometry, Optometry Times, so on and so forth. And Joe, I think, is on their editorial board. So we love those magazines, but sometimes we have to step outside of that box to get some more information. And Nutrients is a magazine here. And this one is from May 2020, strengthening that immune system through your diet and nutrition, you can really help, strengthen you. So one of the best ways, and whether you're not going to turn this into a vaccination or anti-vax discussion, but I chose to get vaccinated, but I also chose to make sure that I have a great supplement, good, antioxidants going into my body that, I've traveled since July 12th. I'm not going to go through the list, but all the years of my traveling, and I've traveled a lot. I never made it to diamond status on Delta. This year, I'm making it to diamond. I've been traveling. I've had to come across, knock on wood, but I'm moving around, and I truly believe, and that's going to that complementary type of that I've very well supplemented, and then having the vaccination, and that's kind of that integrative approach here. Not just saying I'm all going to do it on diet and nutrition. I'm not going to do it just alone with a vaccination. Kind of that holistic type of approach. And from this magazine, they were pointing out, a whole bunch of proteins and lipids and fiber. But I take a supplement, and the things circled here are what they were recommending in this article. And what I wanted to do is do a quick comparison what I was taking. And what I was taking had all of this in it, the same circles and these same circles that are there to kind of help show like, okay, I think I'm feeling pretty good about what I'm taking. And what Tracy was talking about back in, at SECO, it was funny. We did the oral antibiotic and antiviral, but we just kind of said towards the end, Tracy's got this little concoction that, might help strengthen your immune system. Virus is another. Before we knew that the COVID was the same way, it was kind of assumed, but now it's coming out that oxidative stress that's out there. Now, with that being said, what are free radicals? It's when an electron shell misses, or that shell out there is missing an electron. And what the antioxidant is supposed to do is come along and help, repair that before taking it from a healthy cell. And I got a really cool slide coming out here. So I'm going to try and point out in some eye way, so I'm going to try and show you some OCTs where true oxidative stress, oxidative damage, oxidative stress. And what gets picked on a lot is the mitochondria. And look right there, when you see all these slides, I'm trying to pull all these terms together. It's responsible for those epigenetic alterations, not the stuff that your parents gave you, but you got genes that are there that are going to be stressed based upon now what you're giving them nutritionally that's out there. And you'll see that carotenoids you cannot get as your body produces it. You got to get it from the things that we eat. And free radical formation forms here, and there's different variations of free radicals listed. And I'm going to do a real quick experiment here, guys. Watch, it's a lab. I'm going to create free radicals for you. Watch here. I'm going to do it. Ready? I'm inhaling. I just exhaled, right? Aerobic respiration. When it goes from that oxygen to that water, not everything gets neutralized in my body the right way. Free radicals have formed, but luckily I've got enough antioxidants on board that it's hitting the antioxidants and not going and damaging the cells. And there's a whole list of things here on this right-hand picture: ultraviolet, air pollution, and the list goes on. And you can see how quickly we can tilt that because we don't have enough antioxidants in our body. And one thing I learned is our body triages, right? So when you see someone that just gets done eating a great breakfast, right? They didn't eat a lot of meats, they ate lots of fruits, they ate lots of vegetables, and they did a great job of eating a good breakfast, and they walk outside and take a big, bold cigarette puff, right? So why is that bad? Your body triages. When your body senses those toxins coming in, it says, sorry, cell membranes, I have to go take care of all these toxins from smoking. So your body triages that's out there, and that's why, in a sense, smoking is bad. Now, Tracy, we got an animation here that says, remember those hidden stressors.
It was just a reminder. I said you would see this kind of peppered throughout. So with that functional diagnostic nutrition, they were talking specifically about environmental, hormonal, neurotransmitter stressors, et cetera. And that's exactly what we have here. It's just, from a different source, from a different perspective. But once again, what's contributing to that oxidative stress and inflammation that can trigger all these
and to
problems.
kind of echo Tracy, maybe you can hit a few of them, but hidden is actually an acronym, right?
Yes.
Hormone, what's the I?
The hormones. Oh my gosh, I can't even remember them all, Greg. But essentially detoxification, environmental is one.
It's back on the slide. And I just wanted to point out that it's not, the hidden is kind of neat because they are hidden, but you made that kind of neat in that it's an acronym for those stressors that are
I remember all of them except the I.
there.
Inflammation. It's inflammation.
There we go.
There you go.
So here's what we're talking about when we talk about, remember that phospholipid bimembrane that's out there? We've learned about it. Here's the cells here, kind of this, the lipophilic ends are lined up here. The hydrophilic ends go to the outside. So we got water loving. This is what happens whenever we don't have a lot of antioxidants in our body. So here's what we're trying to show you. What I'm trying to show you on this picture is down here, maybe some DNA and different things that are inside the cell, the mitochondria. And someone that has a low score, this is what their cell membrane looks like. And this is not what you want when you're having all these oxidative stressors coming out, these hidden stresses that are out there. And I love doing this when there's a live audience, but I usually say to the live audience, what is vitamin E? And most of the people or someone in the audience will say, well, vitamin E, I'll ask, is it water soluble or fat soluble? And a lot of people say, well, it's fat soluble. So they're right. And it embeds itself into that fat loving part of the membrane. And, you hear some people out there, oh, you're just trying to sell me some vitamins and just get me some expensive urine. Well, yeah, if you're taking a lot of vitamin C, your body only needs 800 and you're taking 1,000, well, you're going to pee off 200 of it. But it's water soluble. That's why you'll pee it off. You're not going to pee out vitamin E in a sense because it's fat soluble. But vitamin C goes to the outside of the cell and to the inside of the cell. And then you start adding in some other carotenoids and polyphenols and flavonoids. And I just listed a few here: beta carotene, lutein, and lycopene. Now look at that cell. That's the cell that you want. You want to say now, bring on those free radicals. And so when that electron cell hits this mitochondria, let's say this is the cell membrane of the mitochondria, that now when it hits this, it doesn't destroy or cause the mitochondria to become stressed. It is properly protected. So to go back, that's not what you want. This is how you want your body protected through this type. This is more of an antioxidant type of protection. So there are places to use integrative or functional approach. And the DEW study 2 was one of that. Tracy, do you want to talk about that DEW study a little bit?
Sorry, I was reading the comments. There are a couple questions in the comments that we'll get to as well. Just give us a couple minutes, and there's a good place to do that. So I just wanted to, remind everybody with the DEWS-2 study as well as the DREAM study, this was, adding a little bit or peppering in a little bit of an integrative approach to patients, in the sense that, with the DEWS-2 study in particular, it has the stepwise approach. And as patients move through the steps, there are recommendations regarding naturopathic integration in patient care. So the other thing was, here's this pathophysiology of dry eye disease. We have lots of things mentioned here. We've got we've got our cytokines mentioned here. We've got surface stress. We've got vitamin A deficiency over here on the bottom right, et cetera. So the DEWS-2 study in and of itself looked at the, functional and nutritional components of dry eye disease and what we can do to help that. In this, I think I do have an animation on this. In this particular slide, I'm just, pointing out specifically for DEWS-2 the dietary modifications, including oral essential fatty acid supplementation with this first arrow here on the upper left, and then on the bottom left, use of some of our oral steroids as well for anti-inflammatory purposes. The DREAM study was, if you recall, they looked at omega-3 fatty acids as the active part of the arm, and the placebo form part of the arm was just olive oil, and their outcome was not as anticipated, and they were kind of saying, oh, I don't know if omega-3 is all that great. But when you compare something to olive oil, which, oh, by the way, is a wonderful omega-6, non-inflammatory omega-6, which is also an essential part of diet, it's not really all that unusual that the results would be not that significant between the two, because they're both required essential fatty acids for our bodies. So with the omega-6 versus the omega-3, a lot of omega-6 that we get in the good old-fashioned American diet, well, let me say that a different way. Generally speaking, in the American diet, we get plenty of omega-6, but it's just the wrong omega-6. It's the inflammatory omega-6. So what we need, in a sense, to balance all this out is something called gamma linolenic acid, GLA, along with our good omega-3s, our EPA and our DHA. And when you hear things about the Mediterranean diet and why that's so wonderful, it's because it gives you that balanced ratio of omega-6 and omega-3. I just wanted to mention a couple quick things to move along here, and you have this for your information as well. But for general EPA, DHA, omega-3 guidelines for dosing, most people will take 1,500 to 2,000 milligrams per day, combined EPA and DHA. You can do that as one dose, or you can do it 2 to 3 times per day. But for people who have autoimmune disease, and that could be all different types of autoimmune disease, the doses tend to be much, much higher, somewhere between 3,000 and 5,000 milligrams per day, which is a whopper dose. But if you have, true inflammation that's either acute or even just that smoldering inflammation, which comes with chronic autoimmune disease and even cardiac disease, you need a higher dose. The issue with our typical fish oil that we see over the counter is there are absorption issues. So I speak about this all the time. So if you've heard me speak, I'm like a broken record, but there's something called a resolvent fish oil. And a resolvent fish oil is literally just the next metabolic step after we take our traditional EPA and DHA. So if I went and got a bottle of EPA and DHA from CVS or from Sam's Club or wherever, and I took that every single day, and I've done this actually to see if it would make my omega-3 levels increase. And it didn't, because I have pretty significant autoimmune disease. My body was not able to biotransform it, make it into the next metabolic step. And remember, metabolism for drugs is literally how the body breaks them down, or sometimes how the body breaks it down to get rid of it, but also the metabolism of drugs or supplements is how the body breaks it down so it can use it. And that's the case with our fish oils. So this resolvent fish oil is still just EPA and DHA, but it's the next metabolic step. So it's the broken down version of EPA and DHA, which is a usable form. And the next slide is just showing you essentially here at the top with the alpha linolenic acid. That's what we get from our dietary sources or people who are using non-fish oil based products. That has to be converted into EPA and DHA rather. And then further, EPA and DHA has to be converted into this SPM. This is the resolvent fish oil, the specialized pro-resolving mediator. And once we get to this SPM portion, by either the multiple steps to get there, if we're using a different product, you hope and pray you can get it broken down into that resolvent step, or by just taking the resolvent fish oil, which is what I've been doing for years. Look at what it does in the bottom right blue box. The resolvent fish oil, as long as you can get it to absorb, if you take it as that particular product, supports the resolution of latent immune response and inflammation. It's treating that smoldering chronic subterranean inflammation. It can cause tissue remodeling, a return of homeostasis in cells. That's everything. That's exactly what we need, along with other nutritional support to get rid of some of this inflammation that most people suffer from in some way, shape, or form.
So the key here is, I want to try to bring some, Tracy and I lecture, as you guys have seen, she does the pharmacology side, and I try and bring the optometry side into it. So, whoever thought that using Vyzulta, latanoprostene bunod would be considered, in a sense, complementary in a way. And I just pulled this from our slide deck with our, 2018, 2019 pharmaceutical update. And we're talking about the prostaglandin, but then they added nitric oxide to it. So what I wanted to focus on was the nitric oxide, which is a gaseous free radical when it's in the body. It's a signaling compound. But in the plants, and that's what I want to kind of point out here at this slide, is that, when a plant's carotenoids, and we talk about, the nutrient density, what I learned is a bowl of spinach from, Canada more nutritious than something that's grown pretty easy in Scottsdale. So you have a cup of spinach from Canada and a cup of spinach from Scottsdale. Well, the answer is, if it's in the ground and in Canada, stress to the harder weather's in the ground long enough, the carotenoids are the defense mechanism to the plant. And that's why they maybe build a little bit higher. And when things are mass produced in greenhouses and not really out in the stressors, just grown quickly, then those strong carotenoids that are in there are not there for the defense. So in this case, nitric oxide is in the plant to help protect the plant, but when it gets into the body, it becomes this signaling compound. And that's why when it gets into the body, or that's what B&L has done here, is they've kind of taken the conventional pathway and used nitric oxide to work on the trabecular meshwork, the endothelial cells, and the blood vessels regulating distal to Schlemm's canal, and using nitric oxide to relax that smooth muscle. And it also influences calcium, potassium pumps. Now, here is a slide from the Aries slide deck for Nutraceuticals. Nothing's doctored up here. I just copied it. There's all the references here. And during their slide deck, as we do those dinner programs, they're showing this nice, healthy trabecular meshwork. Over here, they're showing the stiffened and TM, and it actually doesn't allow, because of this stiffness, doesn't allow that fluid to flow through. But look what they're saying caused it. They're saying oxidative stress, cellular damage that's out there. And this is some work from Tom Freddo that I just took to kind of show that this is the trabecular meshwork. This is where this nitric oxide would be working, relaxing the smooth muscle. But here's Schlemm's canal and a collector channel. So down here is the anterior chamber going through the trabecular meshwork, Schlemm's canal going to a collector channel, and then back to the venous system. The nitric oxide is working on the endothelium here. It's working on the blood vessels. So in a sense, Vyzulta is a it's using the adjuvant of nitric oxide, but it's also using something in nature to help out there. So kind of a neat little combination there. Tracy, I know you have a few molecules you want to talk about, and then I'll talk about maybe how we can integrate this more into optometry.
Yeah, you have some specific patient cases, and I'm monitoring the chat. We'll hit those few comments or questions at the end. They're all kind of related, so I didn't forget about them. We'll hit them at the end. So just running through a few of the potential nutritional supplements that are very popular right now and those that are beneficial in patients. First, we start from a functional perspective with water. The general adult should drink 100 ounces of water every single day. I always say, do not go from drinking 8 ounces today to 100 ounces tomorrow, because you'll be peeing all day. It's something that in order to integrate all of that hydration into your, typical, all your cells in homeostasis, you just have to walk up to it. The other thing too is, most people take in plenty of sodium each day. But one thing to consider there to make sure that water's staying in our blood vessels, et cetera, and lubing all the gears and whatnot, sometimes switching to a good sea salt is a great idea as well. Anything greater than 100 ounces of water per day does act as a diuretic, so you have to be careful there. I drink a lot of seltzer. I love bubbles, but only 50% of my water intake per day is represented by seltzer. Our Pellegrino and things like that are natural mineral water. If you want to spend $40 a day on Pellegrino, you could drink all 100 ounces of water as your Pellegrino. And then for every alcoholic or caffeinated beverage you drink, you should drink double the amount in water, just to hydrate and grease all the skids, so to speak. So there's our rainbow of vegetables and fruit. It's called the equalizer. There's epidemiologic evidence that shows there is an inverse relationship between dietary flavonoid intake, which comes from all these beautiful colors, and heart disease. So once again, now let's look at some of the supplements that you can get that contribute to this change in epidemiology as well. Most of you have heard of coenzyme Q10. It's also known as ubiquinone because it is in fact ubiquinone. It is found in foods, but it's also typically supplemented, and most of the time you will do better in supplement form should you need coenzyme Q10. It's muscle mitochondria we know uses ubiquinone. We know this because we've studied why people on statins sometimes get the muscle aches and pains, and part of the equation is there is a deficiency in ubiquinone. So some people take ubiquinone or CoQ10 prophylactically when they start on statins. Some will wait and see if they have any aches and pains, and then maybe they'll do the coenzyme Q10. But it's one of the most widely used supplements for that type of problem. The wonderful thing about CoQ10, and I take CoQ10 every day, is it's also just a good overall anti-inflammatory. And actually, as we move through this, I'll go to the question that asked about that Greg mentioned, can you just use resveratrol? Whoops, that went too far. Can you just use resveratrol by itself? I mean, theoretically you can. What Greg said I agree with, which is lots of these things need other vitamins and minerals, et cetera, to work together so that they have a synergistic and, best relationship for things to absorb and work in the body. But if you have a pretty good diet and, well, let's say if all is going well, but you have some underlying inflammation that you're worried about, things like turmeric, resveratrol, quercetin, coenzyme Q10, turmeric, I'm not sure I mentioned that yet. They are good anti-inflammatories. What we want to avoid, though, is just getting supplemented to death with all these individual supplements when we can take them, together in certain forms as well. Everybody's heard of zinc. Zinc is out there as something that is good for potentially decreasing the risk or the severity of respiratory infections, common cold, influenza, maybe SARS-CoV-2. The other important point is zinc is incredibly important for the production of thyroid hormone and for thyroid hormone to work efficiently. That doesn't mean only people who have an intact thyroid or thyroid organ. I have no thyroid. Mine was replaced because of, or taken out. It wasn't replaced. I take a replacement every day with Synthroid, levothyroxine. I do take the brand name. So even for somebody like me, who's completely had a total thyroidectomy, I have no functioning thyroid gland at all. I need to take zinc to ensure that the T4 that I'm taking as medication is utilized correctly in that negative feedback loop. So moving along here, and I did see a question pop up about why is it not a good idea to drink your entire daily water intake with carbonated beverages? It can actually change your systemic pH. So that's the issue, and it does occur in some people. Some people do the litmus test where you hit it on your tongue. I do that occasionally, and it tells you if you're acidic or alkaline, and then that's how I kind of augment my apple cider vinegar that I drink, etc. But most people don't do it, throw the old litmus test on their tongue. So in general, good old-fashioned water is never a bad thing.
And that's where you hear
Melatonin.
the first P of the morning that's out there when you listen to these docs, the first P of the morning to see where you are, whether you're, alkaline or acidic.
And which is which, in case anybody asks.
We've been in case someone asks, I'm not following you.
Oh, well, so what should your first P in the morning look like?
I think it's supposed to be alkaline is where it's supposed to be, but that's one of those 8, predictive biomarkers or 10 predictive biomarkers, depending on who you're listening to and how many is, we talked about hemoglobin A1C, the first urine of the morning, first P of the morning is where, and I think it's supposed to be alkaline. I'm not to that point where I'm testing yet, so I don't know.
Yeah, and you can really get mired down in so much of this stuff, but every single thing you learn, it becomes part of the puzzle of this integrative approach to yourselves and your patients. Melatonin, most people know melatonin as a soporific agent, which just means a pharmacologic fancy word for helping you to go to sleep. It is great for that. Some people use it for anxiety as well. It is a nice holistic sleep aid. It's also been looked at in prevention of SARS-CoV-2, or if you've been exposed, that type of thing, or if you actually have COVID-19 to lessen the severity of it, along with 8 to 10 other things that are taken in a cocktail, because we know it does decrease inflammation. And the thought is, particularly with COVID, that it would decrease risk of lung fibrosis. So lots of different anti-inflammatories here. Quercetin is one of my very favorites. If you look at it, it comes from yellow crystalline pigment seen in plants, red, green, purple pigment in fruits and veggies, even onions. It is a flavonoid, has wonderful antioxidant, anti-inflammatory action, and it does decrease the expression of anti-inflammatory genes like interleukin. And that's what all of these do. It's just very specifically spelled out with the quercetin. So things like our resveratrol, our quercetin, our turmeric, our I can't even remember the whole list I've gone through here. That's what all of them do, and why they're so important together and sometimes by themselves. Used as a supplement to decrease allergies and to boost immunity. I take quercetin along with a couple of other supplements and something called a Th2 modulator. I know it sounds like something that would be on a spacecraft, but it is literally to augment my allergies. As I age, my allergies have gotten worse, which is pretty typical. And quercetin is one of the wonderful things that I don't miss it. I take 2 capsules every single day, and it decreases my allergen load and my allergic potential. It also can certainly decrease systemic inflammation in my body elsewhere, which is what contributes to allergies to begin with. So lots of different wonderful benefits. This is just a little more information on quercetin, talking about the ability of quercetin to lower inflammation and oxidative stress. So, potentially good for those with heart and blood vessel related disorders, decreased risk for type 2 diabetes, et cetera. And resveratrol may have similar benefits. There's a lot of overlap here. The whole point is each one of these has a different component to that epigenetic benefit, improving your epigenetic profile that will decrease oxidative stress and ultimately inflammation.
So I have my technician on the supplement that I use and use in the office. And she came up to me the other day, Tracy, and she goes, "Hey, I just want to let you know, I usually get beat up at the end of the year here in Pennsylvania with a goldenrod." And she's like, "It's been a great season." And I said, "Well," I know for sure quercetin is one of those, but I think all these working in harmony has helped you out. And she's like, "That is pretty cool." So
yeah, that is pretty cool. Mine are pretty good with all my little cocktail here. Here's our resveratrol, another potent antioxidant and anti-inflammatory nutritional supplement. It very specifically comes from red grapes. This is where the phrase "red wine is good for you" comes from. And in small quantities, half a glass or 1 glass per day, it is maybe good for you. It's certainly better than beer or, sweet pink wine or whatever. But we've also seen benefits in cancer, heart disease, Alzheimer's disease, arthritis, skin inflammatory conditions, etc. It's almost like each one of these has been shown to have benefits in one particular place, but there's all overlap with those places. And that's kind of the beauty of it. It does have some absorption issues, which can be problematic with a lot of supplements. So you just want to find a company and a product that has done absorption studies, and those have been verified by an outside lab. Calcium is fantastic. We need it, but the problem is we so oversupplemented calcium for so many years, and that went on until probably 10, 15 years ago. And still patients and some practitioners really do overthink the calcium rather than doing calcium along with vitamin D3 and K2. I love this phrase. I couldn't remember who said it, but it was a functional medicine doctor. Calcium is like water. You need it to survive, but you can drown in it. So here's the problem. Pathologic calcification is known as calcinflammation. It's essentially when we have misplaced calcium, it can float around in the bloodstream, and it actually gloms onto points of inflammation in the epithelial lining and other inflammatory cells, actually. Then it can't move to the bones. So it needs a carrier. So that's why D3 has become such a big deal. And now K2, if you've heard anything about that, you need D3 and to some extent K2 to actually deliver the calcium where it needs to go in bone marrow and on bones. So they all work synergistically together to get all this done, to put the calcium where it needs to go and help the patient. So here's our D3. If you have low vitamin D levels and you're given a prescription for vitamin D replacement, you will get a prescription for vitamin D2. You'll go to the pharmacy, they'll give you well, it depends upon the strength that they have, but essentially you're going to get 60,000 units of vitamin D2 once per week for 6 to 8 weeks. So you take it 1 day a week and you do that for 6 to 8 weeks. Vitamin D2 has terrible absorption. So when I did this, I was like, okay, I'll play your silly game. I'll take the D2 because my levels were horrifically low. So I did it for 8 weeks, went back, and my vitamin D levels didn't budge hardly at all. So I switched to D3 and used K2, calcium, et cetera, kind of in a synergistic trio. And when I went back just 3 months later, I think my levels had tripled. So vitamin D3 just has much better absorption. It's known to have some anti-inflammatory antioxidant rather, and neuroprotective properties as well. And here's that K2. Vitamin K2 is an antioxidant. You probably have heard of vitamin K. everybody's heard of vitamin K. Most of the time you've heard of vitamin K1, which is the phytoquinone that comes from our deep green leafy veggies and can have an effect on blood coagulation. Well, it does have an effect on blood coagulation, but if you're taking warfarin or other anticoagulants, we have to really watch vitamin K1. Vitamin K2 is the menaquinone, which comes from animal proteins and fermented foods, that kombucha, sauerkraut, etc. And it's been shown, particularly in menopausal females, to decrease risk of vessel disease, and it helps decrease those large levels of calcium in the bloodstream floating around. And then the last thing I'm going to mention here is the gut microbiome. The gut microbiome is so important. I mean, it's almost like the essence of almost everything we're talking about here. So we know that there's something called gut permeability syndrome or leaky gut syndrome. I think it's colloquially more known as the leaky gut syndrome. But essentially, when you have a leaky gut, it allows the passage of toxins, antigens, sometimes food, pieces of food, and bacteria to enter the bloodstream. And when this happens, you have things in the bloodstream that are not supposed to be in the bloodstream. These are things that are supposed to be excreted from the body. So this even of itself can trigger inflammation and autoimmune disease. Probiotics can reverse or repair leaky gut by producing tighter junctions, which is wonderful, so that these toxins and antigens, et cetera, can no longer get through. So we know, because it's been proven that, even kids who have been on many, many different regimens of antibiotics, that's where it starts in those kids, unless we're really treating that gut microbiome and replacing it with our probiotics. All right, Greg, your turn, and then we'll hit the questions at the end.
Yeah, and we're going to just kind of take into account here optometries and integrative. As you can see here, 8:10, Tracy and I have just started giving this lecture, and I'm a little bit behind here. I'll go through this pretty quickly and try and hit the highlights that are out there. And I think the biggest bridge that we can do is within optometry is talking about carotenoids, because we all been trying to measure maybe through macular pigment density. And my big soapbox from the podium has been that, lutein and zeaxanthin are super important, but yet, we're not going to cure that metabolic retina just by a macular pigment. And remember, the whole retina has a macula that is 5.5 by 5.5 millimeters in size. And you got this huge retina, and the macular pigment is in that 5.5 with lutein and zeaxanthin. But it's also been shown to be a biomarker, a measurement of your fruits and vegetable intake. And ocular diseases such as macular degeneration, diabetic retinopathy, and glaucoma. And that's what has led me to, to the point of becoming maybe more integrative from an ocular disease. We're not going to do the polling question in the sense of time here, but ask yourself, do you agree that free radical formation is a progressive process that leads to cellular damage and death? And this is part of the problem here. This was going to be a polling question, is how many oranges of today does it take to make 1950? And it takes 21 oranges of today to get something that has the same amount of vitamin A from 1950. And that just goes to things are mass produced, they're not in the environment long enough. And carotenoids are used to be the protection of that plant. And then when we pick that protected plant and eat it, then that's how we get our carotenoid. So this is the M Lounge at the Marriott, and I've seen transition over the years of putting in some bananas and fruit along with all the processed foods. And I did reach for the watermelon whenever I was here, but you can see it doesn't look really, really red. It has some water in it, but I'm not sure the nutrient density. It was better than me picking some of this other stuff that was down, or this cake down below. But, the great equalizer to these hidden stressors is all these fruits and vegetables, which have carotenoids, flavonoids, and polyphenols. And I think we're familiar with E, C, and ubiquinone, and down here, beta carotene, lutein, and zeaxanthin, and neutralizing the free radicals. But this is coming out of an Onco Target magazine And you can see that our body does have some endogenous antioxidants that are in there, which are enzymatic and non-enzymatic. But if you go to the exogenous, this is where I keep coming back: diet and lifestyle, what you eat, and epigenetics, because vitamin A through K, beta carotene, ubiquinone, then the polyphenols and flavonoids. There's your quercetin. And someone was asking, I think, about turmeric is in here, and curcumin that's in here, or curcumin, sorry, that's in here. And these are all have to be taken in through fruits and vegetables that we eat out from there. Now, when it comes to carotenoids, this is what kind of gets me on my soapbox: is there's 600 in nature, 50 in the 50 in the human food chain, and 15 to 20 of them that are in the bloodstream. Now, when I would ask the audience, what is the most important part of the macular pigment? I think a lot of us would say that it is, antioxidant, but really it's the third lens of the eye, right? That's, you got your cornea and your tear film, lens one, your crystalline lens, but the macular pigment is to help us with contrast sensitivity and see better. And that's why baseball players like to have their carotenoids level checked, or the macular pigment checked, because it helps them see the baseball that's out there. But the key is that it's only in the inner retina. So have you measured carotenoid levels in your office? Look at this right here. It says the annual review of nutrition, again, using different magazines here, carotenoid status and the status and disease. Carotenoids appear to play a key role in disease, dropping down to here that maybe it should become an integral part of our of our eye care, right? And it talks about the different ways of measuring it. Let me just show you oxidative marked cellular damage at its best or at its worst, whichever way you want to look at it. See, here's my key, is that the lutein and zeaxanthin go into that inner retina, but this is a disease of the outer retina. And I'm going to point out to you as we go through quercetin, catechin, which in green tea, resveratrol. But I've been lecturing in OCT, and we have OCT Connect with Julie Rodman. But I want to point out this ellipsoid zone right here, this ellipsoid line right above the RPE, right? The ellipsoid, the inner and outer segment, it's that hyper reflective line. I want to point that out because I was trying to figure out, why does it hyperfluoresce? And in doing some digging and talking to people, it's because it's the mitochondria of the photoreceptor. So when you follow this line now where my pointer is here, you have a nice hyperreflective, then it starts to get a little bit shady here. There's oxidative stress, ladies and gentlemen. Now this one's being blocked right here by the blood vessel, but as you go across, you can see that this mitochondria line, especially right here and right through here, is starting to die off. It's not as hyperfluorescent. That's oxidative stress, cellular damage. And when that mitochondria start to die, that's why the vision starts to drop on these patients. So I just asked through this question, is it better? And I know the macula is this whole thing, but my point is, do we want to just cover the macular pigment, or do we want to cover the avascular, the vascular zones, or do we want to cover the whole retina that's out there? And this is what's frustrating whenever I hear speakers say, it's controversial what to do with this patient. This patient has drusen. It is not controversial. Drusen are definitely showing that there's a lack, that there's oxidative damage going on. There's inflammation. We need to be intervening at this stage. Now, I'm agreeing it doesn't need to be AREDS 2. AREDS 2 is just too high of the nutraceuticals, and it's really just treating the inner retina. I like to go something that's full retina. I like something that is out there that treats the whole retina. And whenever we do look at the pathophysiology, this is the RPE, this is the photoreceptors. We're looking at Brooks membrane. We have cholesterol here, and we need to use devices out there like functional devices, because we can't see that stress that's out there, and it's continuing to happen. Then we finally get the drusen formation. We could be doing a lot of things before that drusen forms. And in diabetic retinopathy, we can see the vascular disease that's occurring before we see the dot and blot hemorrhages that start occurring. We can see the vascular formations that are occurring here. And there's lots of work through Paul Chaus up in the Northeast, either Washington or Oregon, who's a diabetic himself, has PRP and has done lots of integrative work out there and what should be doing for patients with diabetes and getting them on a full type of supplement. And back to the glaucoma side here, where we're looking at the trabecular mesh work. And this was Sissy here showing atherosclerotic formation. But if you look way back into this process, we see oxidized LDL. And maybe we want to try and get patients on a good supplement to prevent. And that's how it's all connected. Full eye formula now becomes a full body formula. And antioxidants enhance perfusion using oral antioxidants out there in nature or in supplements. Nutraceuticals for the treatment of diabetic retinopathy and the treatment of AMD. You know, smoking depletes the serum, your body triages, but I really won't change my patients and put them on supplements unless they promise me to change their diet and exercise just a little bit, manage those systemic diseases, getting them on, in a sense, a full type of retinal supplement. And then the other question would be, would you consider yourself, do you ever recommend resveratrol and quercetin when treating ocular conditions? And here's something that I read out of Oxidative Medicine and Cellular Longevity. You know, again, going back, asking ourselves, why are we only treating half the retina? What I mean by that, why are we just treating the inner retina? And why are we just only treating part of the retina? Why aren't we treating the whole retina with carotenoids, polyphenols, quercetin, and resveratrol? Because it has been shown to be augmenting the oxidative stress or the inflammation that's out there. You hear us focusing a lot on resveratrol. Here's that Onco Target magazine, oxidative stress, the role of physical exercise and antioxidants. And here it says resveratrol, and this is why I like pointing out the mitochondria line on the OCT. And there's other mitochondria within the axon of the ganglion cell in glaucoma. And we're talking about ganglion cell environment, metabolic diseases, regulating the levels of some inflammatory mediators. There's that word cytokine. And then it says up here, furthermore, maintains the vascular fitness. Other hand is irrelevant. It is relevant in blocking the formation of new blood vessels, like inhibiting VEGF, right? It's a natural VEGF. So when you use something like this, a full retina formula, and they're getting injections, there you go. We've got an integrative approach going on in helping these patients. So I've been measuring macular pigment, trying to find something way over the years. There's subjective, there's clinical. This slide comes from Dr. Chris Putnam, a good friend who actually did his PhD work in here. And I just want to talk real quickly and show a case of what I've been doing in the office. I stumbled upon this scanner that helps me measure carotenoid levels in the palm of the hand in a very non-invasive and in a repeatable way, much better than the macular pigment. And it's been validated multiple times. It is a biomarker for health and diet. There's that biomarker again. That's what's building up in the phospholipid membranes, kind of measuring the carotenoid levels. And the test was developed by the National Institutes of Health that studied macular degeneration and cancer. Really, really cool technology. Started off as being huge and now is funneled into like this small little test. How Raman spectroscopy works, I hate to make it simple. The companies hate when I do this, but yellow and blue make green. Carotenoids are yellow. That's what's in an egg yolk. Blue light at a certain wavelength, 478, resonates with the carotenoid and you get out of it 518. So it just tells you the amount of carotenoids that are in the palm of your hand. And that has been validated multiple times, 90 studies as pretty much your fruits and vegetable intake. And then Arvo in 2016 looked at it and said, well, if you're measuring in your hand, is it equivalent to what's in the eye? And they basically said, yeah, the hand scanner is better than the subjective macroscope. They did the hand, they checked the blood, they did the eye, they did all this type of testing. And they came out and said right here, the statement that it's, much easier and better in estimating the macular pigment. So it goes back to, we're trying to protect that cell membrane by putting in the fat soluble, the water soluble, the polyphenols, the flavonoids, just not lutein and zeaxanthin that's out there when we're trying to protect the eye. Let me just go through a real quick case here. This is a patient that comes in and he's 53 years old. Dad has 43 injections in the eye. This 53-year-old's pre-diabetic. We do an eye exam on him, 20/20 vision, retina's clear, OCT normal, passes dark adaptation. And he measures 26,000 on the scanner. Now, a lot of you don't have the scanner and it's not used that often, but this would be an A+. This is an A, B, C, D. This is where he measured down here. We pretty much want people 40,000 and above. So we made a recommendation for this patient, put him on a full eye. You could see vitamins and minerals, but this is where I geek out: polyphenols, flavonoids, quercetin, resveratrol. We do get the lutein in here, pretty much a nice full supplement. He wanted to do something else here, so we threw in some purple corn, some EPA, DHA, some more quercetin, so on and so forth. And then we watched his levels go up to 33 and then 47. Now he's ready to take on, I'm going to do some genetic testing on this gentleman and see if he's got the risk alleles. But if in the case, we still want him properly, with the proper carotenoids that are helping to protect them and not to pull that trigger. Those epigenetics that are out there, the diet, the exercise, so on and so forth. But this is one step in helping protect them, maybe from moving into those injections that his dad has. So we have an N of 4 so far in the practice where I'm able to get these drusen that are starting to disappear by doing a full type of eye formula that's out there. So I do want to launch this question now, because I want to see how people do here. Do you consider yourself, now that you understand that maybe you've prescribed, do you consider yourself an integrative optometrist? And Tracy, what did you say the other day when we were in Boston? I don't know, you didn't know, but now you know, and now you didn't know. How did you put that? And you might be on mute if you're talking.
There we go. I was answering all the chat questions. You didn't know that you knew, but now that you know that you know.
There you go. So I'm just going to end the poll here so we can end pretty much on time here. But let's share those results.
Can I give you one question while you're looking at that?
Yeah, so here, well, I'm just going to share the results, and it's kind of neat here, right? And your saying goes, because now we have 91% believing that they're an integrative optometrist now that we've explained it. Go ahead.
So lots of great questions and comments. There's one that I have no idea how to answer as not being an optometrist, but it said, how about addressing the high intensity car headlights and their effect on the eyes, body, hormones, etc.?
Yeah, I mean, that's a whole other kind of coming out of the neurons, right? There's a whole other set of neurons that are in the retina that go to the lateral geniculate body that are responsible, which is a whole other lecture. The only thing I can say in a short answer is maybe we'll put a talk together on that, but there's that's circadian rhythm, the blue light, the neurons and treating them and making sure that they're healthy. Totally something to that. Yes.
Great, thank you.
So Tracy, we're about 3 minutes over here. Tons of questions rolling in, which usually is what happens. Maybe we should cut the lecture back and then just sit or maybe that's what we'll do. So maybe we'll just make, like we did for glaucoma, maybe make a functional and integrative talk where we can just go back and forth. But do you have any final thoughts? Well, here's one here. Let me just read this one real quick. Does Raman spectroscopy work on all races? And the answer is yes. It's not a pigment in a sense, melanonin. If you're thinking of melanin type of measurement, it's a carotenoid. So the cool thing about it is it's kind of a 60-day biomarker, right? That's another thing I like about it. If I scored low, like I was 26, like that 53-year-old, And I was 26 when I started, and I can tell you I'm in the platinum range now. But anyway, digress back. If I would have, when I scored 26, my serum would have been low, but I could have ran out and bought a whole bunch of kale and blueberries and made blueberry kale shakes and chugged them. And then went then a week later, and my blood serum levels would have been up. What I like about it's kind of like the hemoglobin A1C of carotenoids. It's a 60-day marker. So it's kind of funny when I measure people, it's kind of like I turn into a priest. They're starting to say, well, doc, it might not be that high. I did chug a bottle of vodka over the weekend. I was at a party, this and that. That's fine because it's a 60-day marker. But go back, yes, it is, can work on all races. And I'll scroll through the questions here, Tracy, if you want to make some final thoughts. And
So,
you're muted.
yeah,
Okay,
no,
there you are. You're back.
yeah, I'm back. Sorry. So yeah, I was just kind of popping through the questions as well. So please feel free to email me, email Greg, email both of us should you have any questions at all. Maybe Greg, you could pop those into the chat real quick.
Yep, it's on the screen.
But
If they want to screenshot that or take a picture, I have my email
perfect.
and I have your Salis email there. Yeah, I know you have a Gmail, but there's our phone numbers also.
Yeah, and there's lots of good questions coming in. So yeah, shoot us emails, please. I think one of the greatest things we can do going forward is, also doing another talk on how to utilize these in primary care, how to utilize these in your patients, how to sort through the info and make decisions. But yeah, these can be absolutely life-changing for you and for your patients for sure. Thanks for spending your Sunday night with us.
And I'll echo what Tracy just said. Thank you for taking integrative and functional medicine, new opportunities in optometry. It's always an honor and a pleasure to share the podium and tonight a screen with you, Tracy. As always, thank you for doing this.
Thanks, ditto.